You've been doing some really interesting research on GLP-1-RAs for type 1 diabetes,
Yeah.
specifically Wegovy and Mounjaro.
Right.
And not just how they work, but how the timing of those medications could be a game changer.
Mm-hmm.
So let's unpack that because it's a conversation buzzing in the diabetes community right now.
It really is.
Yeah,
There's a lot of excitement about the potential of GLP-1 RAs as an off-label treatment for type 1.
right.
But like with anything in medicine, the details matter,
Of course.
especially when it comes to dosing.
Exactly.
Yeah.
So to set the stage for our listeners who might be new to this,
Sure.
can you give us a quick rundown of what makes GLP-1-RAs different from traditional insulin therapy?
Absolutely.
Okay.
Think of it this way. Insulin is like the key that unlocks your cells to let glucose in and bring your blood sugar down.
Okay.
But there's a whole other system of hormones that impact how your body handles that blood sugar.
Right.
That's where GLP-1 RAs come in.
Okay.
They work by mimicking the effects of incretins, which are hormones your gut naturally produces.
It's like those little gut messengers telling your body what to do after you eat.
Exactly.
Yeah.
They help stimulate insulin production,
Mm.
slow down digestion, and even tell your brain when you're full.
Wow.
And what's interesting is that these medications don't actually replace insulin, they work alongside it.
Okay, so that makes sense for type 2 diabetes where the body might not be making enough insulin
Right.
or using it effectively.
Mm.
But why all the hype for type 1?
Yeah.
You're already taking insulin to cover your needs.
That's the key question.
Right.
While someone with type 1 diabetes doesn't have an issue with insulin production,
Right.
these medications could offer another layer of control by fine-tuning those other hormonal processes we talked about.
Okay.
Specifically, they impact glucagon, which raises blood sugar,
Mm-hmm.
and ghrelin, often called the hunger hormone.
So potentially fewer blood sugar spikes,
Yeah.
better appetite control,
Mm-hmm.
and maybe even needing less insulin overall.
You got it. And that's what has everyone so intrigued.
Right.
But here's where the timing aspect comes in.
Okay.
To really understand why, when, and how often you take these medications matters.
Okay.
We need to dive into how the body processes them over time.
Because even though they're usually taken once a week, that doesn't mean they're working at the same level all week long.
Exactly.
Right.
And that's where things get interesting.
All right. Well, you've piqued our curiosity. Let's unpack why this timing is everything when it comes to GLP-1 RAs and type 1 diabetes. So we're talking about timing being key for these medications, especially for those with type 1.
Right.
Why is that?
It all boils down to how our bodies process medications.
Yeah.
It's called pharmacokinetics.
Pharmacokinetics.
Yeah.
Sounds intimidating.
It's actually simpler than it sounds.
Okay.
Pharmacokinetics just means how much of a drug gets into your bloodstream,
Mhm.
how long it takes to get there,
Right.
how long it stays active,
Okay.
and how your body eventually gets rid of it. These factors can make a big difference in how effective a medication is,
Right.
especially for something like blood sugar management where you want consistent results.
That makes sense.
Yeah.
So how does this relate to Wegovy and Mounjaro?
Well, even though you inject these medications once a week, they don't work at the same level throughout the entire week. It's more like a slow release.
Okay.
And the amount in your system actually fluctuates quite a bit.
Okay. So let's break down those fluctuations.
Sure.
What does the research tell us about how these medications behave in the body?
Let's take Wegovy first.
Okay.
It usually takes about 24 to 72 hours for Wegovy to reach its maximum concentration in your bloodstream,
Okay.
meaning it takes that long for you to get the full effect of the dose.
Okay.
Now, for Mounjaro, that peak happens a little faster,
Hmm.
usually between 8 and 72 hours after you inject it.
So far, so good.
Yeah.
But you mentioned these levels fluctuate.
Right.
How significant are we talking here?
Yeah. Here's where it gets really interesting. Wegovy has a half-life of about 7 days.
Okay.
Think of it like a slow, steady stream.
Mhm.
It takes a full week for your body to eliminate half of the dose.
Okay.
Mounjaro, on the other hand, has a shorter half-life,
Okay.
more like a quick burst of energy,
Oh.
clearing out faster at around 5 days.
So if it's clearing out faster, wouldn't that mean fewer fluctuations with Mounjaro?
You'd think so, right?
Yeah.
But when you combine that shorter half-life with the fact that it reaches peak concentration quickly, it actually creates more dramatic swings in the amount of medication in your system throughout the week.
Wow.
We're talking 40% above and 30% below the average level, even with the once-a-week dosage.
That's a significant difference.
It is.
I'm starting to see why those fluctuations could be a big deal for people with type 1 who rely on predictable medication levels for blood sugar management.
Right.
But how does that actually play out in day-to-day life?
Let's say you're a few days out from your Wegovy or Mounjaro injection. Those medication levels start dipping, meaning there's less to suppress glucagon.
Right.
You might experience higher blood sugar levels than expected,
Yeah.
even if you haven't changed your diet or insulin doses.
And then after your next injection, when those levels surge back up,
Yeah.
wouldn't that cause blood sugar to dip lower than usual?
Exactly.
Yeah.
It's a constant balancing act.
Right.
And it's not just about the direct impact on your blood sugar either.
Oh,
Remember how we talked about insulin sensitivity?
yeah.
How well your body responds to insulin?
Mm-hmm.
Fluctuating incretin levels can impact that too.
This is all starting to make a lot of sense now,
Good.
especially when you consider that people with type 1 are already managing their insulin very carefully.
Right.
So if their insulin needs are constantly in flux because of these medication swings,
Yeah.
it could make things incredibly tricky.
It can be.
Yeah.
It's like trying to hit a moving target.
Right?
And we haven't even touched on ghrelin yet. If those hunger hormones aren't being consistently suppressed because of the fluctuating medication levels,
Right.
you might experience more cravings,
Okay.
especially towards the end of the week when the drug levels are at their lowest.
Okay, so we've established that these fluctuations could throw a wrench into blood sugar management, insulin sensitivity,
Mm-hmm.
and even appetite control,
Right.
which are all crucial aspects of managing type 1 diabetes.
Absolutely.
So what can be done about it? Are there any potential solutions to this dosing dilemma? So we've uncovered a potential challenge with these weekly injections,
Yeah.
these ups and downs of medication levels
Right.
could make managing type 1 diabetes even trickier.
Mm-hmm.
But you also hinted at some solutions.
Yeah, there are some promising avenues being explored. Hold
Okay.
on,
What are researchers exploring to address this?
one of the most intriguing is shorter dosing intervals.
Okay. So instead of that once-a-week injection,
Right.
you're talking about more frequent dosing.
Precisely.
Okay.
Think of it like this. Instead of one big spike and a long decline, you're aiming for a steadier stream of medication.
Sure.
Research suggests that injecting more frequently, say every 3.5 to 4 days,
Okay.
but with a lower dose,
Mm-hmm.
could smooth out those peaks and valleys,
Okay.
leading to more stable medication levels throughout the week.
So instead of riding a roller coaster,
Uh-huh.
it's more like sailing on calmer seas.
Exactly.
Right.
Imagine, if you will, being able to eat a similar breakfast every day
So-
without worrying about a drastic blood sugar swing.
Right.
More consistent GLP1-RA levels
Mm-hmm.
could lead to better regulation of glucagon,
Okay.
making your morning blood sugar much more predictable.
Okay, now that's a benefit I can get behind.
Haha, right.
But wouldn't more frequent injections be a burden for people?
It's a valid concern.
Yeah.
No one wants to be tethered to their injection schedule.
Right.
But remember, we're talking about smaller doses with these shorter intervals,
Okay.
which might come with fewer side effects.
Right. That makes sense.
Plus the potential benefits of better blood sugar control, consistent energy levels,
Mm-hmm.
and maybe even fewer insulin adjustments
Right.
could be life-changing for some.
That makes sense.
Yeah,
It becomes a trade-off.
exactly.
And it's really about figuring out what matters most to the individual
Right,
and what fits best with their lifestyle.
exactly. This is where that personalized approach to medicine is so important.
Right.
It's not one size fits all.
Of course not.
What works for someone who thrives on routine might not work for someone who values flexibility.
Right. So for someone listening to this
Yeah.
who's maybe struggling with those end-of-week blood sugar swings or increased cravings,
Right.
what's the takeaway? What should they do with this information?
The most important message is you are not alone.
Right.
It's not your imagination. Those fluctuations are real.
Right.
And they could be impacting your diabetes management more than you realize.
Right.
Knowledge is power, right?
Mm-hmm.
So arm yourself with this information, track your blood sugars and experiences,
Mm-hmm.
and then talk to your doctor.
Have that open and honest conversation with your healthcare provider
Exactly.
about what you're experiencing
Right.
and whether exploring alternative dosing strategies like shorter intervals might be worth considering.
Exactly. And remember, this is still a relatively new area of research,
Of course.
especially for type 1 diabetes.
Mm.
But that's what's so exciting.
Right.
We're on the cusp of a potential paradigm shift in how we think about GLP1-RAs
Right.
and how we use them to improve the lives of people with diabetes.
It really highlights how important it is to stay informed and engaged in your own health journey,
Absolutely.
because who knows what other groundbreaking discoveries are just around the corner.
Absolutely. And that's what makes this field so fascinating.
This Has been a deep dive indeed.
Uh-huh.
We've gone from the basics of GLP1-RAs
Right.
to the complexities of pharmacokinetics
Yeah.
and the potential of personalized dosing strategies.
It's very
We hope you found this exploration insightful and empowering
Yeah.
as you navigate your own diabetes journey.
And remember, this is just the beginning of the conversation.
Right.
Always consult with your healthcare provider to make informed decisions about your diabetes management.
Until next time, keep exploring, keep asking questions, and keep diving deep.